This is Giovanna King, and I am the School of Nursing IRC liaison, and I am actually a graduate student myself, and I'll be graduating here in a couple months in May. So since we don't have the video with the guidelines and a sample presentation of what a home visit looks like for some of you, but for some of you, you'll be doing virtual visits. So we have to be flexible. But I just pulled up in my computer the 4 attachments that was sent to you back in the beginning of March. It's actually an email that I forwarded an email from Paige, who is the coordinator of the children's health classes. She's a pediatric resident at Primary Children's Hospital. So I just wanted to show you guys, I'm not going to be in the video just because I don't look very presentable right now. But I wanted to tell you, if you are doing home visits or if you're doing a virtual visit, usually you have kind of the first part where you introduce yourself, make sure you have Farah's contact in your phone number, and basically safety first, right? If at any point you feel unsafe in a situation, you should leave or call for help. We should dress professionally. We need to be mindful of different cultural and beliefs, personal cultural beliefs. So just dress appropriately, and it's okay to have your hair uncovered. And wear your name badge, even if you're doing virtual visits. It's just important to have a professional appearance. Sometimes wearing a stethoscope, it's a prop that's important for nonverbal communication, and it just helps them to know that you are there kind of in a capacity of a nurse practitioner, student, and or a physician. Okay, so the first thing you want to do, like, it's called the social phase right here, which is the social phase of a home visit. And also, if you're doing virtual visits, I try to get to know the clients a little bit more, what their names and children's age, even if they are older than 18. I ask them where they are from, what their favorite hobby, or what their favorite food to cook is. So just to kind of break the ice. And then we go on to introduce the purpose of the children's health classes. Again, reinforce the idea of welcome. Tell them, I know you have already been in Utah for so many months, but we want to welcome them to Utah. Let's see what else. So you there's a little script here. I'm not going to go over the whole thing, but this particular document is called Home Visit Curriculum and Guidelines. Okay, and so after you introduce yourself and kind of follow these guidelines a little bit, you're going to go to talk a little bit about the levels of healthcare, and you have access to this handout too. For those of you doing virtual visits, you'll be showing this to the clients. They can see that on their phone through the WhatsApp. And if you are doing a visit, I would just print a few copies and bring it with you to give to them. It's always important to leave something tangible that just kind of reinforces the information. And then you have this PowerPoint that Paige, the resident in charge, did to kind of facilitate and tell you what you're going to be talking about. And if you just follow this, basically it's pretty self-explanatory. And again, we say it takes 1 to 1.5 hours to present all the information. The information itself is not a lot, but you do have the interpreter, and sometimes we get sidetracked a little bit in our conversation. The clients are lovely, and personally, I always want to know more about their background and where they came from, what they have for breakfast, and just kind of cultural things like that. But if you have time, I think that's very appropriate, but we try to focus on the lesson first. So talking about the levels of care, very important to explain to them when it's, ask them who their primary care doctor is. And I try to write it down if they don't know their name or number. Usually the interpreter sometimes who are also their caseworker will know that information. And basically you go over when is appropriate to go to the primary care doctor, what kind of why you would go. Trying to make this into a presentation mode, but it's not going to work. So just say encourage them going for health checks, especially for children who are young, get their immunizations, and then we'll go on to urgent care, and we usually try to help them based on where they live, kind of write down the nearest urgent care is and explain to them when you would go to an urgent care. And again, this document, which is called the Refugee Teaching Topics, so that one has also information. Basically, this is all stuff we know, it's basic information, but sometimes if you want to get a little more in depth, you can kind of use this as a guideline. Like you would call your doctor if you have diarrhea, but if it's the weekend or a 3-day weekend, they're not open and it's been like 48 hours, you definitely want to encourage them to go to the urgent care. Then hospital. With children, we always encourage them to go to primary children's hospital, and then when to call 911. And just as a side note, since they started this program, the use of 911 for non-emergency services has decreased dramatically now that more of the refugee population has been oriented and educated about when to call 911. Okay, so we went over when to call your doctor, where is the closest urgent care, primary children's hospital, what kind of injury, like if they're severely sick, fever that's lasting more than the guidelines, major injuries, bleeding, broken bones. And then of course 911 if they're not breathing. And when you're in the client's home, you can actually, the interpreters are great, but sometimes I feel the need to kind of act a little bit, somebody who has like chest pain or just seizures, things like that. Okay, and then the curriculum moves on to child health education. And in the past, we used to do pre and post surveys. We're still asking them these questions just to kind of guide the class and to kind of get a baseline of where the clients stand regarding child health education. So we kind of ask them these informations, and you would be surprised how much they know, especially when it comes to dehydration. Some of the clients have spent quite a bit of time in refugee camps. So they know how to make oral salts, the rehydration salts. So you'll be surprised that they know quite a bit of this information. So it's kind of, for some of them, it's a review. Okay, but do take time to ask them these questions. So ask them, what is the best way to prevent the spread of infection? And sometimes washing your hand is kind of overlooked. And again, we have to remember people from different cultures. Maybe this is not the first thing they think of. So that's where we come in. And if you have, and I'll show you the kit that I have here. This is the kit that Farah will be dropping off to the clients. I put together a few kits. I just need to drop it off. So it has some of the stuff. So I usually, when you're doing the class, you show them the hand wash, or if I am in the client's house, I'll show them the hand sanitizer and put them a little bit in their hand and mine and show them to actually cover the whole hand and do the friction. Okay, so things like that. Washing hands, of course, and we emphasize that we wash hands after we go to the restroom, before we prepare food, before we eat, and just the basics of hygiene. Then another question over here is about what temperature equals a fever, and we usually ask the clients if we are in their home, we'll give them a thermometer and we'll ask them to show us what a fever is, so to kind of tell us what the number is. What else? Signs that a child is having trouble breathing, and again, it's basic child health education, like retractions, turning blue around the mouth, and just noisy breathing. Okay, and then how can you tell if your child is dehydrated or vomiting or diarrhea? You have your symptoms here, and what do you give them to eat or drink. And again, a lot of the clients have made their own oral rehydration solutions before. They're very familiar with this recipe, but also we try to tell them they can either do that or they can have some of these Pedialyte or electrolyte solution around the house for when they really need it. So that's something that comes in the kit that we leave with the families. And then what can they do for fever, for pain? So we do have in the kit, if you're doing a home visit, you can leave them the dosage. And if you have your own scale, you're welcome to bring it to the client's home to weigh the child so you can give them an accurate dosage. If you don't, we kind of go by I think the age. So if you have an accurate weight, then it's more exact. And then you ask them if they have any questions, if there's anything else they would like to talk about. Then after you're done with the little class, you go back and you do the post test. You ask them these questions again, just to make sure they understood the information, okay? So basically this is it. It's pretty simple and straightforward. The levels of a healthcare, and these are all the attachments that I sent to you. And again, if you can't find it, it's buried in an email. Just send me a text at 801-698-0091, or you can email me, and it's u101-7479, and I'll send you these handouts again. But yes, I am sorry we don't have a real video acting out, but trust me, these are low-key, no pressure, interactive teaching classes, and I wish you the best. And again, this is just a little kit. It's just a little plastic container, and we have the Pedialyte solution. We have some hand wash. We have the hand sanitizer. I throw in some triple antibiotic in there, some Band-Aids, thermometer so we can teach them how to take their temperature. I put in some toothbrushes in there, and just so it's kind of nice to leave the family with a handout if you are doing a home visit, and the kit. If you're doing home visits, text me and I'll drop them off to you, or I will drop off to Farah, who will drop it off to the family. Okay guys, thank you so much and good luck. Take care.